from the human health background. I've always had this interest in the infectious disease control.
I'm an infectious disease doctor before I came here.
I came from a background in conservation from my undergraduate course.
I am a veterinarian by training. I've practiced clinical veterinary medicine in Nigeria. I practiced for about 5 years.
I was ideally looking for something that would be interdisciplinary. That was the biggest aspect that was important to me. When I was trying to decide on which course I wanted to do, I was really looking for something that was going to be more intimate.
So I chose MSc One Health as I think it's an important approach, and it's the expertise that I would have gained from exploring the interdisciplinary nature of the One Health approach.
I wanted to broaden my understanding of diseases and wildlife diseases more to a higher level, while also including the human health and environmental health aspect as well.
But after this course, I now realize the whole picture is actually quite wider.
And I wanted to come into a program where I could really see multiple aspects of public health directly in front of me.
But having taken the systems thinking module last term, it gave me a different perspective, a different look to things, and how different things, even the thing you might consider most inconsequential, come together to drive things that have huge consequences on both human, animal, and environmental interface.
We've learned so much about different types of diseases, environmental, human health, but just the soft skills I gained as well, communication between different stakeholders as well, research skills, time management, all very imperative to being successful.
I think the most thing I love the most is that I get the chance to interact with people from different kinds of backgrounds.
I liked how RVC collaborated with LSHTM as well. So here I was able to collaborate with peers from RVC and LSHTM.
Yeah, if you're a face-to-face learner, then this is definitely the program for you. I think that would be one of the biggest takeaways I had, is if you enjoy working together with people, having conversation and learning in that way is the primary mode of learning. This is a really, really ideal program for that.
With LSHTM, you get to, interact with professors at the RVC, professors at LSHTM.
Kind of supervisor I had from the RVC, she has pushed me to do something quite excellent, or I would say excellent, and she's pushed me to try to write it up for publication.
Your teachers are, world-class researchers, and they contribute to so many global policies that are being devised and being implemented right now. So I really enjoyed that. The multicultural aspect of the group, and just hearing, say during debates or presentations, so on and so forth. It was nice getting different insights from people from such diverse backgrounds.
So, Permanent Secretariat in the One Health Initiative is a co-supervisor to my project, and he introduced me to other important personalities. So I think this program actually widened my network and has given me more opportunities looking forward.
My research project was investigating the presence and levels of anticoagulant rodenticides in UK otters, in Eurasian otters. So I worked with collaborators at Cardiff University, the UK Centre for Ecology and Hydrology, the Environmental Agency, and the Food and Environmental Research Agency.
So I'm doing a project about the MERS coronavirus infection in Bedouin community. So it's probably I would say it's pretty pure epidemiological study, and it utilized the data of the human and camel samples on MERS-CoV infections.
So my research project was exploring the knowledge, awareness and practices of the human health risks linked to BTB in livestock workers in Nigeria. So here I was in Nigeria for 3 weeks, and I was out in the field almost every day at specific study sites.
What I aspire for the next 20 years is that I am in a position where I am making policies, health policies, that benefit other people.
So I will immediately go back to my previous position as an infectious disease doctor. But because I will continue doing clinical research, so I expect myself finding more chances to find collaboration.
My goal would to be working in policy as a veterinarian in livestock, and that will definitely, everything I learned from the course, stakeholder debates, systems thinking as well, is really going to be imperative for my future career, applying all the skills that I've learned here.
So I've recently been offered a PhD up at Stirling in Scotland, and it's assessing AMR threats in aquaculture to ensure resilient aquaculture supply chains. So this One Health approach, the skills I've learned on the MSc course, will enable me to, I'll be transferring these skills onto my PhD.
MSc One Health Ecosystem, Humans and Animals at RVC is a very interesting one, in-depth and well-rounded.
And the RVC environment has been really welcoming from the time I came in to when to now that I'm about to finish.
It's a privilege to have been, affiliated with this institution.
But I can say for sure that I've made long life friends from here.
This is where I want to be.